Are you having issues with landing that dream job of yours as a Psych RN or a Psych NP? Well, in today's video, we're going to be going over tips and tricks and 5 common questions to help you succeed in landing that job. Regardless of whether you're a new grad RN, new grad NP, or an RN with experience wanting to switch to Psych, I'll be providing tips and tricks to help you ace your next interview. What's going on, everyone? It's the Psych Dude, back with another video. If you are new to this channel, let me formally introduce myself. I'm the Psych Dude, and I am a psychiatric mental health nurse practitioner. In this channel, I go over several different subjects to educate the public about improving mental health, topics related to psychiatric nurse practitioners, and ways to improve your overall lifestyle. I hope you guys enjoy this video. Don't forget to like and subscribe for future videos. Congratulations on landing that specific interview you wanted in your dream facility. So now that you've got the interview, here comes the hard part. How does one prepare for that interview? Well, regardless if you're a new grad or an experienced nurse or a nurse practitioner, you must be well versed in answers, and you must anticipate multiple questions being asked to succeed in this interview. Luckily, I've been on both sides. I've been an interviewer and the interviewee, so I have a solid grasp of questions being asked and how to appropriately answer them. Today, I'll be going over things needed to know about nursing interviews, and I'll be going over 5 common questions asked and tips to help answer the questions. So, typically, healthcare employers love asking behavioral-based interview questions. They want to see how you react and how you perform under certain circumstances. The most common themes that most behavioral interview questions asked to nurses are based around teamwork, patient care, adaptability, time management, communication style, things like that you want to look at, and lastly, motivation and core values. So make sure you think about these themes prior to going into an interview and think about how you can address those questions based on those themes. So question number 1, describe a situation when you had to work closely with a difficult coworker. How did you handle the situation? Were you able to build a relationship with this person? So basically, this question goes along with the theme of teamwork. So make sure you keep that in the back of your mind when answering this question. Make sure you never, ever talk bad about someone throughout the whole interview, regardless of what they've done to you. Make sure you explain the situation and why the individual was difficult. Share how you handled the situation. Pro tip, make sure you turn that negative situation into a positive one. Tell them what you've learned throughout the whole situation, and make sure you try to use an example of how you communicated with them effectively to improve the quality of care for the patient. And think about a silver lining to share in your answer. Make sure you always want to mention that you improved quality of care and that you communicated effectively, because that's what a lot of interviewers are looking for. Make sure you relay that message. Question number 2, give an example of a time you had to interact with a hostile patient. How did you handle the situation, and what was the outcome? Unfortunately, in Psych, you'll come across agitated or hostile patients on a daily basis. The interviewer just wants to know how you would treat these type of patients and how you would react. Basically, you want to tell a story about the hostile patient and your step-by-step actions. This question deals with the theme of patient care, so keep that in the back of your mind. If this deals with patient care, you better make sure you emphasize safety, 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 safety. Safety is your number 1 priority to mention. You want to be safe, you want the patient to be safe, and you want other patients to be safe in the unit. Next, you want to mention what you did with the patient from the least invasive option to the most invasive option with like what's learned in school. For example, you want to try and use therapeutic communication to try to talk the patient down first. If you need to resort to something different, then you can go to emergency medications. Then, ultimately, if you have to, you want to use restraints, but try to avoid that situation unless safety is involved. Make sure in the results you mention you want to address safety, because as you know, safety is key in healthcare. Common question number 3, talk about a time you worked in a fast-paced setting. How did you prioritize tasks while maintaining high-quality patient care? So in this question, you want to think about the theme time management. Basically, you want to give them a time where you prioritize your task quickly and effectively. Once you explain your example, make sure you emphasize that you use all of your resources effectively to maintain safety. You use your CNAs when you need to, your LVNs when you need to, your RNs when you need to, and your colleagues when you need to, just to know that you maintain quality of care and safety for the patient. Make sure you mention doing hourly rounds on patient units if you are RN to maintain a safe environment and to check on them if they need anything. Also, you want to mention seeing the highest acuity patients first, then working your way down. Think about nursing school and how you prioritize seeing patients from the most acute to the least acute and balancing that time. Common question number 4. Describe a time you provided effective patient or family education. So in this question, think about the theme patient care. In healthcare, but most especially in mental health, educating the patient and their family is extremely important. As you know, they drilled patient education in our brain on a daily basis in nursing school. So you basically want to tell them a time you provided this effective education. And make sure you try and emphasize patient teachback, because that's important for them to know that the patient understood. Also, you want to emphasize how you use multiple methods of teaching, like verbal teaching, written teaching, or teaching by example. Those are 3 different types of teaching methods you want to use when explaining to the interviewer about ways of educating families or the patient itself. Common question number 5. What do you think is your greatest weakness? This question is always hard to answer because obviously you don't want to talk about your weaknesses in front of someone you're trying to impress. So regardless of how you answer it, make sure you turn it into a positive answer. Whenever I'm asked this question, I talk about how I use that weakness and turn it into my strength by doing a number of things like working harder on it or asking leadership for additional training. Especially when you do ask for training from leadership, a lot of interviewers love the fact that you're asking for help and asking for their advice. An example I love using as a new grad or new to a unit is by saying I lack experience in this specific unit and tell them I'm a sponge and I'm willing to soak up as much information as possible and that I want to be taught by you so you can teach me how to be a model nurse for that specific unit. The biggest thing you want to do is emphasize that you are willing to learn. That is the most important thing, especially as Psych NPs. You want to let the psychiatrist know that you are willing to learn as much as possible. A lot of psychiatrists don't really know what type of schooling we have to go through or what our residency involves and how many hours we have. So you want to let them know that you are willing to learn as much as possible, because at the end of the day, patient safety is the number one thing. And if you let them know that you're willing to learn as much as possible based on how they know their information, then that's important, okay? When answering questions in an interview, I would always recommend using the STAR format. So STAR. This is to help you make sure that the story is direct, concise, and to the point. So S stands for situation, T stands for task, A stands for action steps, and R stands for results. So S, situation. Start by talking about the situation. What was the exact situation? Who was involved? And why did the situation happen? T, task. Explain your role in the task. Why were you involved in the task? A, action. What actions did you take to resolve the situation? And R, results. Detail the results of your actions and make sure you always want to highlight your strengths. Well, I hope you found this video helpful. I hope these tips and tricks will help you in your next interview and make sure you get your dream job. Being in psych and mental health is extremely tough, especially when interviewing, but make sure you always want to emphasize terms like communication, education, chain of command, and that you want to improve quality of care for patients. I know I only listed 5 questions and I'm sorry about that. And I know there's so many more questions out there. Maybe I'll make another video to address these questions. If you have any specific questions you want me to answer, comment down below. I am going to make a more specific video for Psych NPs to help them prepare for NP interviews because those are extremely tough. If you did like this type of video and want me to make more of these type of videos, comment down below so I can make another video with more questions. Thank you for joining me, the Psych Dude. Don't forget to like and subscribe and click on the bell to be notified when I come out with another video. Until next time, guys, take care of yourself. The Psych Dude is out.